Is we envision three phases occurring here. So let me describe to you what the three phases are. Number one is this bill, which we use as reconciliation. As you all know, you can't filibuster a reconciliation bill. So this repeal and replace bill is what we pass through reconciliation. Phase two, all the regulatory flexibility that the Secretary of HHS has to deregulate the marketplace, to lower the costs and stabilize the market. That's what Tom Price will do. There's something like 1,400 instances in this law that gives the Secretary discretion. Secretary Tom Price, unlike the Obama administration, will use that discretion to bring more market freedom and market stabilization. So that's phase two. Phase three is to pass the bills that we want to pass that we cannot put in reconciliation because of those budget rules. What's an example of that? Interstate shopping across state lines. We love that policy. We think it's critical. But as you well know, you cannot put that in a budget reconciliation bill. Otherwise, it could be filibustered. We also believe in association health plans. Let people through their trade associations, farmers through the American Farm Bureau plan, restaurateurs through the National Restaurant Association plan, small businesses through the NFIB plan, bulk buy their health insurance in nationwide buying pools. We very much believe in that policy, but we know the rules don't allow us to put that in reconciliation. Medical liability reform. The practice of defensive medicine is cranking up healthcare costs, practicing defensive medicine, which makes healthcare ultimately more expensive for everybody. But we know we can't put that in reconciliation. Those phase three bills we're going to move also at the same time, and we're going to push those through the finish line, but those will ultimately take 60 votes in the Senate. So phase one is this repeal and replace bill. Phase two, Tom Price deregulates the market and brings certainty so that we can have more choices and more plans and get the states back in the game of being able to regulate health care. Phase three, pass those reforms that we believe in, that we think will make it even better, but we know we can't put in reconciliation because of the 60-vote threshold.